I'm Dr. Whispers. How are you today? Oh, thank you, thank you. Glad. Very good. Okay, let's take a look into your medical history here with us. I do see here that you have come with us in our dermatological clinic for mostly aesthetics and other kind of treatments. The last one was a deep face cleaning, right? Okay. So, how do you enjoy that one? Work well? Happy to hear that. And today you're coming for an issue with your eyes? Okay. Treatment. You want to get rid of the dark circles and puffiness? Very well. I don't really notice much. Oh, you're wearing makeup? Okay, thank you. Very well. So, let me see. In your past visits, you have done Botox with us, right? Over a year ago was the last time? And you decided just to let it go? And this was mostly for headaches and migraines and also a few fine lines. Okay. So has anything changed in the past 6 months that you think it's making this problem more chronic for you? The puffiness in your eyes, maybe you have been dealing with anxiety or not being able to sleep, insomnia, or maybe an underlying illness. Okay. Very good. We need to check out your eyes first. Then we're going to be seeing what kind of treatment we can do for you today. But overall, it's mostly aesthetics what you want to achieve, right? Are you feeling any pain, tingliness, maybe burning sensation in your eyes? Not at all. Okay, that's good. That's very good. How is your diet? Do you consume a lot of sodium foods? Well, with sodium, it's very prominent on fast foods or maybe foods that have a lot of salt in it. Beverages such as sodas, some juices too. And how is your water intake? Okay, thank you. If you can pass this way so we can take a look into your face. Yeah. Okay, are you comfortable in this position? Very good. We are going to be checking first how is the issue of the puffiness. Now that I have you closer here, I can notice it a little bit more. So you're telling me that there is no pain, right? That is a key factor, yes. Now, when do you start noticing this puffiness? It's been quite some time. Have you tried anything to reverse it yourself? Cold compresses? That's great. Yeah, actually the cold helps a lot with the puffiness. But since you're telling me it's not going down, there could be another issue there. Okay. Let's take a peek here. Okay, I'm gonna be shining a light into your face. You may close your eyes if you want. Mm-hmm. Mm-hmm. Okay. Do you have any pain or discomfort when I press the area? How about here? Tenderness? Mm-hmm. Okay. Yeah, it feels like, I'm gonna describe it as a little balloon filled up with water. Mm-hmm. Quite puffy. Do you consider that this puffiness, it's always the same, or does it changes? Does it get more puffy? Do you notice that it goes down maybe at night, or and it's worse in the morning? Always the same. Okay. I'm gonna be doing some pressing. This might be a little bit uncomfortable, but please bear with me while I do this, okay? I'm gonna move your head a little bit here. There we go. Do you feel any pain here? It's just the pressure, but no pain, no sharp pain. Okay. Let me use something different. Okay. This is gonna be a little bit more blunt. Let me know how it feels. There? You feel the pain there? Okay. Now let's check this here. How about in this area? Here? Here? Okay. Well, let me just we're gonna remove everything that you have. You only have makeup on. Okay. Let me take that off, okay? Sometime as we are aging, I'm not telling you that you're old or anything, but it's the normal process of our bodies. Some people tend to retain more fluids than others, and especially if there is maybe history of stress or anxiety or not being able to flush all these fluids naturally, it could lead into this kind of situation, sometimes in the eyes, other times in the face. It depends on every person. But it's something that we can definitely treat. You're going to be seeing an improvement today, but this is something that needs to be dealt with on the long run, okay? Good. Gonna go a little bit closer. Just want to see that there are no broken capillaries. Okay. That's good. Okay, that's a very good thing that there are no broken capillarities. Okay, the treatment that we are going to be doing with you today is, since you want relief from this pressure, we are going to be doing a massage that is going to help the fluid move into the other places of your face and then be absorbed naturally. Okay, this is going to be with pressure and massage. We are also going to be using 2 cc's of an injection in both parts of your under eyes, right here in this area here, and this one right there. That is gonna help with time to not let all this fluid build up this much under your eyes and give you that discomfort. But I also want to do a treatment to depuff the rest of your face, making it feel more comfortable for you. This is a treatment that involves a serum that is gonna be very tingly in your face, and I might say very, very relaxing. It does take about 10 to 15 minutes to work, and that is gonna help absorb all this serum, and with time, well, help depuff your face naturally. For one reason or another, right now we don't know, your body is not flushing out all this fluid that it should be done naturally. Sometimes due to stress, or as I was saying, not being able to sleep, insomnia, or even anxiety. Okay, so let's start by depuffing that area. We're gonna be using this little cutie stuff, a plant. Okay, let's try not to move while we do this. It's gonna feel a little bit cool, but cool is good for the face. Good. Feels nice, right? Yeah, the coolness, it just feels quite refreshing. Yeah, this is something that you can do at home too. We used to sell this here, but we are out of stock, but you can find it at any place. Maybe in Walmart you can find a roller like this. It just needs to be metal, and it's gonna help you with that. Yeah, but in your case is that you're not flushing the fluids. So even if you do it alone, but without treatment, the puffiness will be coming back. So we want to treat that underlying issue. Very good. Let's go with our first treatment. We're going to be using this Bio Aqua roller. This is going to be absorbed on this area of your eyes. Now this one is gonna feel like your skin is being pulled. Okay, just so you know. There we go. It feels cool, yes. Feels really nice. Gonna let it set for a bit. I'll be putting this cotton top. We're gonna let it set for a minute, okay? There we go. Now I'm just gonna take here for the injections. We are gonna be using just 2 cc's for you. You don't really need that much. The injection, yeah, that's for the long run. That is gonna flush the fluids with time. It's gonna command your body to start flushing it out as it should. Okay. And let's take this off. Very good. It's starting to look much better. Feels better. You don't feel that pressure. That's good. That's good. Okay. Now, the injections might be uncomfortable, might hurt. So we're gonna put some numbing cream because I don't want you to feel discomfort. Yeah, this area of your eyes are very tender. So anything that we put there can lead to bruising. So there's a possibility that there could be some bruising. I'm hoping not, since we have done all these other treatments that is helping with that, but there might be a small chance. We don't know. Everybody's different. But the bruising is quite minimal. It's only in the area that we applied the injection. Okay. Now the needle, as you see, is quite small. You're barely gonna feel it. Let's put the numbing cream. Very good. You're going to start feeling a tingly sensation and then numbness. I'm pretty sure with the steam treatment that we're going to be doing after this, the bruising is not going to happen. Let's wait a little minute so it starts working its magic. Let me know when you start feeling the tingliness, okay? There it is. Okay, good. Let's do a little test. I'm going to touch it. Let me know if you can feel it. Can you feel this? Can you feel this? This. Okay, we are ready. There we go. Ever so slowly. Good and good and good. Now this is gonna help a lot in the future with the fluid buildup. Very good. Doesn't hurt, right? You're fine. Very good. Good, 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 good. Okay. We have applied everything. Very good. Okay, I'm gonna prep you up now for the next treatment. I'm gonna put a cap in your hair so it doesn't get too wet. There we go. We're going to set the machine for 10 minutes to 12 minutes. I think should be nice. That is going to definitely help with the swelling and possibility of bruising that hopefully is not going to happen. There we go. Okay. So I'm gonna set it up and I'll be back in 10 minutes time, okay? In the meantime, you can close your eyes. This is safe to breathe, safe for the eyes, but it might get a little bit wet. I'm gonna put a cover in your clothing too to protect it, okay? If you need anything, you have a little button right here. You can touch it. There. That is gonna beep me, so I'm gonna be coming back to you. Okay? I'll be back. Enjoy. Took a little break, little nap. Told you it was really soothing. Let me take this cap off. Oh, that is great. There is no bruising at all. That is amazing. Your skin has worked perfectly. No bruising, no marks whatsoever. The puffiness is completely gone. The dark circles are less visible, it's still there, but it takes time, as I was telling you. But I would say overall it's a great improvement. You have a mirror on the side so you can take a look. Yeah. Isn't it great? It looks very, very good. I'm so happy with the results. Okay. I've taken out the excess here. Normally this gets absorbed. That is great. It also helps with the hair, you know. Got a little bit there. We use this to help people grow their hair back when there is a stress levels that makes it fall out. So it's great for that too. Very good. So now we can go back to the desk. I'm going to tell you what are the next steps that we're going to be doing on your treatment. Be waiting for you here. So we have done the treatment, and this is going to help alleviate the sensation that you were having, especially the puffiness and in the mornings. Now this is going to take a little bit of time to actually reverse. What we did today is the first step towards changing what it looks like under your eyes, but it does take time to reverse the problems with the sleepless nights. That is gonna help you greatly with that. Okay. I'm gonna send you home with a little pill. It's mostly natural. That is gonna help you relax and sleep at night. It's not addictive, so it's great. We're gonna try to avoid caffeine after 3 p.m. Yeah, any caffeine, sodas, coffee, no, nothing like that. At least for, let's say, 6 weeks, it's gonna help you a lot. And also, it helps a lot with the puffiness. Yeah, right now you see your face glowing, but if we continue with the same activities and the same bad habits, this is just gonna come back, and it's a vicious cycle. Okay. And I'm also gonna be setting up an appointment for a month from today, so we can do another checkup. Hopefully there will be no more puffiness. There could be still some dark circles, but that does take a little bit more of time. And if that is the case, we can go with a more in-depth treatment for that. That is gonna change the look. With the injections that we applied today, it's gonna help you quite a lot in the looks, but it does take some time for it to completely start to disappear. How about by this time will be nice for the next appointment? We're gonna be calling you to set up to see if you're available. Okay, good. Very good. So I have a sample here of the medication that I was telling you. Now I would like you to take it before bed, at least an hour before bed. It's sublingual. You just put it underneath your tongue and let it dissolve on its own. Don't bite it or squeeze on it. Okay, that's not gonna work. And you're gonna start noticing this sensation like drifting off. So make sure to always take it when you are at home and you're ready to go to bed, because it can be quite fast, especially on people that are gonna be trying it first. But believe me, that is gonna help you a lot. Okay, so I have set up your appointment and also the further treatment, and that will be all. Do you have any questions? Well, it was my pleasure. I will see you in a month. Just remember my recommendation, especially with water and caffeine. This is going to be very important for the puffiness. And try to maintain, if possible, lower levels of stress. I know it can be difficult, especially nowadays, but try to maintain, well, it's possible. Not maybe looking at the news too much, or maybe practicing a sport. Yoga is very good. Walking, just walking, reduces the levels of stress too. Well, it was my pleasure. Thank you so much. And I will see you in a month, okay? Of course, take care. Your samples are going to be ready in the reception with my nurse. Thank you. Yes, Karen, the patient is going. Please give them the 24/8 samples of our relaxing pills. Thank you so much.